Good afternoon to you all. My name is Dr. Fundi Lenyati, the founder and the host of the Dr. Fundi Digital Health Channel. Welcome to you all once again. Today we are going to be having a live masterclass that will be discussing various aspects of what is referred to as narcissistic personality disorder, and a whole range of issues around that. We have a special guest today, and our guest is Ms Liezl Anthony, a clinical psychologist who has been in practice over the last 22 years. She's also an executive coach, and also she's the head of the Employee Assistance Program at Proactive Health Solutions. Liezl, welcome to the Dr. Fundi channel.
Thank you very much, Doc. I'm happy to be here.
Thank you very much. The topic that we are going to be discussing today is actually a topic that is a response to public demand. A lot of people have written on my, various channels asking that we find somebody who can actually come and just share about, narcissists. That's how people just refer to, they say narcissists. They don't know personality disorder or anything, just say narcissists. Somebody to just share, give insights about what kind of people are these, how do we get to know that this person actually exhibits, the traits or actually has a disorder, of a narcissistic nature. So we hope that over the next 60 minutes, you'll be able to help us to better understand what, this problem is all about. But before we get into, the questions around this topic, I just want to ask everybody who has joined us to please like, or subscribe to our YouTube channel. And even share if you find that the contents of this discussion are actually useful. So because we aim to make this podcast, the Health Matters podcast by Dr. Fundi, to be one of the leading podcasts in South Africa when it comes to matters health. So we can only do that with the support of the people. So that's what we would like people to help us with. We will keep on coming up with, relevant content, but we also want people to support us. So now that I'm done with that, I'm going to start by, saying this thing of personality disorders. You are a clinical psychologist, you know a lot about these matters. But when we say somebody has a personality disorder, what are we talking about?
Yes, Doc. I think in your intro, I think it's important that we start with that, clarify what is a personality disorder, and then, zoom in. So essentially, a personality disorder is a mental health disorder of personality functioning. So what that means is there's significant impairment in how a person interacts with others interpersonally and in different situations. So it's not a once-off. It's not something that is, just per event or incident. It's something that is persistent and pervasive over a long-term period, and it affects or impairs their personal functioning with
So
others.
are you saying we can only make, a judgment around whether it's a personality disorder or not over a period of time? I can't, just see and experience somebody in some situation and then say, this person has got a disorder.
Essentially, you're correct. So I think what is very important in order to make a diagnosis of a personality disorder is obviously to be seen by a professional that has got the skill and the expertise to do that and the training. So psychologists, psychiatrists, sometimes medical doctors who've trained should be able to look at what are the criteria, that this person exhibits. And very important is collateral information from others in this person's life that will basically support the diagnosis,
Yeah.
and the fact that it should have been there over a long period of time.
Yeah. So you're basically saying personality disorders, in the main, they affect interpersonal interactions, that is, relationships with others.
Yes.
All right. Now, obviously, we're just building up to our main topic, which is about narcissistic personality disorders. But when we talk about personality disorders broadly now, I know there's a way that they are classified, right? But you are better placed to actually just give us a sense of, how are these, because there's many different personality disorders. And maybe at what point do we call it a disorder?
Yeah, correct. So I think what we use as our guiding document, book, manual, is the Diagnostic and Statistical Manual, also called for short the DSM.
Yes.
So, and currently what we use in the psychiatric field is the DSM-5, which is the 5th edition.
Yeah.
And there is a list of criteria. So under personality disorders, we look at different clusters of personality disorders. So you have 3 main clusters. And they're basically called cluster A, B, and C. And just to mention for interest's sake, under cluster A, you would have the types of personality disorders are really characterized by odd or eccentric behavior. And
odd or eccentric.
Or eccentric behavior. So certain people might be seen as more of a suspicious or peculiar nature, more detached personality. And the types of personality disorders there under cluster A would be your paranoid personality disorder, your schizoid personality disorder, and your schizotypal personality disorder. But that's
so there's so like people who are suspicious of others, that maybe they are being persecuted in one way or the other.
Correct. More people that are very wary, very suspicious, a sense of paranoia, a sense of worry about, am I being persecuted, or
So that's the cluster. That's the
cluster
first
A.
Cluster A.
Correct.
All right.
Then we move to cluster B. Cluster B is really characterized there by dramatic or erratic behaviors.
Dramatic or erratic behavior.
Yes.
Yeah. Can you just expand?
So further, just a little bit basic. Also, it's really people that experience very intense emotions. And they can engage in extremely impulsive, theatrical, promiscuous, or law-breaking behaviors.
Now that's hectic.
So that's the cluster B.
And you're talking about, once you talked about illegal things, I'm thinking already antisocial. Would that be part of that?
100% correct.
Okay.
100% correct. So under cluster B, you would have your antisocial personality disorder, which is also sometimes referred to as psychopathic.
Okay.
And then you have your borderline personality disorder. You have your histrionic personality disorder. And then today's topic, your narcissistic personality disorder.
So our topic of today, the narcissistic personality disorder, comes from cluster B in the classification of personality disorders.
Correct. That's characterized, like I said, by dramatic or erratic behaviors.
Okay, this is sounding interesting. Let's go to the third one.
The third and the last one is your cluster C. And this is really your types of personality disorders that is characterized by excessive pervasive anxiety or fearfulness. So people, they tend to be very, very anxious. And under that is 3. You would have your avoidant personality disorder. Your dependent personality disorder, as well as your obsessive compulsive personality disorder.
Okay. All right. But anyway, we are not here to talk about all of these other, personality disorders. Our focus today is on narcissistic personality disorders.
Correct.
I'm even interested to know this name, narcissistic, that is, coming before the personality disorder. Where does it come from? There must be some some history to it.
Yes, yes. So very interesting. The name narcissist is actually derived from Greek mythology.
Yeah.
And, Greek mythology is oral tradition of storytelling. And the story goes that there was this mythical hunter.
Yeah.
And he was actually called Narcissus.
Yes.
So the story is being told, he was quite beautiful, quite handsome.
Yeah.
And he was also very proud of his looks.
Yes.
To the detriment of basically others.
They are so consumed by themselves.
Very self-absorbed, this particular hunter called Narcissus.
Yes.
Quite self-absorbed in how he looked.
Yeah.
And very, very proud and ignored everybody else.
Yeah.
So as punishment by the gods, because in Greek mythology we always had these gods and you needed to live a certain lifestyle.
Yeah.
As punishment, he then fell in love with his own reflection in a pool of water.
What?
Yes. But he never realized that he was actually falling in love with
himself. Yeah.
And at the end of the day, he basically died of unrequited love.
Wow.
Because remember, the punishment was I am ignoring everybody. So never getting objective feedback that you're actually seeing your own reflection.
Yeah.
And falling in love and just being consumed by himself and his self-importance and his beauty.
Yeah.
And eventually then died. So that is really where the name narcissist comes from, or narcissistic personality disorder. So it should give you a little bit of a hint of what it's all about.
It sounds like we're going to be talking about somebody who's very much pathologically in love with who they are. Maybe let's just get on to the actual criteria.
Yes.
In the field of psychiatry, everything, there is a criteria. One must exhibit certain things before they can be classified that they have a particular disorder. Therefore, when you are sitting with your therapist or psychiatrist, they will be trying to find out if you are exhibiting those things and the number of those things, how long they've been there, and other related information is what will guide that therapist or psychiatrist to actually put you and say you fit within this criteria or not. So let's get on then to the criteria of narcissistic personality disorders. As per the Bible of psychiatry, which is the DSM-5.
Yes.
Yeah.
I'm actually going to take you through some of those specific criteria, and then we can, elaborate a little bit and speak more about that in general.
Yeah.
So I think one of the main things that's stipulated is significant impairment in personality functioning.
Yeah.
That's the main thing. So that is impairment in self-functioning as well as impairment in interpersonal functioning.
Yeah.
So when we talk about self-functioning, it speaks to how do I define myself and myself, what is the definition of me and my self-esteem. So exactly that, an inflated sense of self, exaggerated self-appraisal, a sense of grandiosity. But it could also be exaggerated, inflated, but also deflated, because a lot of people become they're quite envious of others, and that might lead to a deflated sense, because it's quite envious, especially where others get praised or validated. They might develop a deflated sense of self. So
they would like to be the ones who everybody claps for.
Exactly.
But when others are clapping for him or her, they don't particularly react well.
Exactly. And they can oscillate between these two extremes of feeling a great sense of inflation, but also feeling very degraded or deflated.
Okay.
And also then goal setting. Goal setting is really set because they want approval of others.
Yeah.
They seek constant approval, validation, admiration all of the time.
Yeah.
And they feel quite wounded or hurt when they don't get that type of admiration.
So they must always be pumped up, their ego must always be pumped up. And so if you don't give them, that positive pumping up, it may actually affect them.
Yes. definitely, and affect them quite deeply. And they have personal standards that are unreasonably high. They want to be seen as exceptional in everything that they do, in who they are, in how they present themselves.
Yeah.
So that is really personal functioning. And then in terms of interpersonal functioning, empathy is quite key. It's extremely key, and they struggle to show empathy to others. So
these people are challenged when it comes to putting themselves in the shoes of other people, basically, which is what empathy is.
Yes, the ability to be able to feel somebody's emotions, experience that. They struggle. They have limited to no empathy for others.
Yeah.
So impaired ability to recognize or identify with the feelings and needs of people in their lives.
Yeah.
And that can be in a work situation, in a family situation, in a relationship.
Yeah.
Definitely, even with friendships.
Yeah.
And obviously there we see pervasive, a concern with others, because if you're unable to show empathy, that's going to lead to problems in any relationship.
Yeah.
And especially with parents. And we see that a lot of either mothers or fathers might struggle with their children when that is evident. But also in terms of intimacy, so their relationships are largely very superficial.
Yeah. Yeah.
And it exists to serve only their own importance or their own self-esteem.
Yes, yeah. So once again, self-centered.
Yes. Yes.
In relationships, it's about them, although it takes two to tango.
Yes.
But they are the important party in their relationship.
Correct.
Yeah.
So one of the questions sometimes is, can a narcissist actually express love? Can they say, I love you? So yes.
What's the answer?
Any person can say, I love you, but what a person with narcissistic personality would do is to say it for their own benefit.
Yeah.
So it's more about how will you then react after I've said I've loved you, in terms of your feelings towards me. How will I benefit, basically, apart, and not about your reaction to it.
But maybe I just need to ask a question before then. Mm-hmm. Are they capable of loving somebody else but themselves? Maybe let's start there. Even before we talk about whether they can express love.
Yes.
Can they actually love somebody else?
I think if it's to their benefit, yes.
Okay. So there must be an upside for them to... So then they might go into relationships for wrong reasons.
No, definitely. It is all about how will this serve my purpose? How will this increase my self-importance?
Yeah.
In that sense. So intimacy, when it comes to interpersonal relationships, like I've mentioned, empathy, lack of empathy, and then intimacy, very superficial.
Sure.
Yes.
So I'm just going to be naughty now. Mm-hmm. So if they are busy, it's been a very cold week this week. So if they are busy with action, it's really about satisfying themselves more than satisfying the partner.
In most instances, yes. Yes.
Okay. All right.
Or it would be choosing a partner that would gratify whatever needs they have.
Sure.
Yes.
Okay. Yeah.
Okay. So let's go on to what are some of the personality traits that they exhibit.
Yeah.
So we've looked at the functioning and impairment in functioning of self and impairment of functioning in interpersonal relationships.
Yeah.
Now we have to look at personality traits.
Yeah.
And these are really, antagonism and attention seeking. And when we talk about antagonism, it's about grandiosity.
Yeah.
It's about feelings of entitlement, whether that's overt or covert,
yeah.
Whether it's obvious or not.
Mm-hmm.
A sense of entitlement, a sense of being self-centered, self-absorbed, and firmly holding to the belief that they are better than others.
Sure.
And they can be quite condescending towards others, especially those that they believe are not on their level.
Sure.
And attention-seeking, excessive attempts to attract and be the focus of the attention of others, and be adored and admired by others. So admiration-seeking.
You know, as you are talking, I'm thinking of many people that I know who are exhibiting some of these things, and I'm starting to think, do these people have a disorder? Or maybe it's just some traits, you know, not a full-blown disorder, but yeah.
And that's the important thing, because I think we've blurred the lines when we talk about personality disorder, narcissistic personality disorder versus I think a person is a narcissist, meaning exhibiting some of the traits. And I think we'll probably speak about that a little bit more.
Yeah.
So breaking down some of the traits just a little bit,
Yeah.
you know, is, like I said, having an unreasonably high sense of self-importance.
Yeah.
And they require constant excessive admiration. So if they're in a relationship, they constantly want to be told that they are beautiful.
These guys
have a good
must
body.
then be thriving in this time of social media, where you can look at the likes, you know, how many likes, how many things have been shared. You know, my article, if I'm a, you know, if I'm a scientist,
Yes.
you know, how many people have cited my article, you
Correct.
know, and those kind of things.
But also feeling quite aggrieved when they don't get the number of likes.
Ooh.
And becoming quite angry. So we'll delve into that a little bit.
Yeah.
But quickly just talking about some of the traits.
Yeah.
They also sometimes, a lot of the times, feel that they deserve privileges and special treatment, whether those are deserved or not.
So they want to be VVIPs in situations.
Yes. Yes.
You know, they can't go and watch Kaizer Chiefs and Pirates and sit on the normal stands. They must be invited to the executive suites.
Exactly. And they want to be associated with people within a certain standard of living. And they feel that others, that they need to be seen within that grouping as well.
Levels.
Yes.
They are
Yes.
very conscious of levels.
Definitely.
Okay.
Definitely. They expect to be recognized as superior, even sometimes without achievements. Or they feel that they deserve certain types of promotions, even
Yeah.
though they don't have the necessary requirements.
Yeah.
But even those with the requirements sometimes feel that their knowledge is superior above everybody else's.
Wow.
Yes. So, and sometimes they could even make achievements seem bigger than what they really are. So, exaggerating talents and achievements. They're also very...
So I'm sure, you know, when you're asking for this guy's biography, or even just look at their Facebook profile,
Yes.
they will list each and every, you know, recognition that they got.
Yeah. Yeah. And maybe inflate it a little bit.
Okay.
Also preoccupied with fantasies about success,
Yeah.
about power, about brilliance, about beauty, about what the perfect partner would look like.
Sure.
So very obsessed with, let's call it preoccupation with success and power and achievements and
Well,
brilliance.
there's many of us who are preoccupied with power and success, but as long as it doesn't get to one's head in a way that it starts to be, you know, a problem. Yeah.
So I think it's excessive bragging
Yeah.
to the point where people become quite irritated
Yeah.
and actually questions it.
Yeah.
Is this actually true? Because
Yes.
there's this preoccupation with, it's building up my profile, my
Yeah.
status. Like I said, a sense of superiority, a sense of grandiosity, and a sense of I can only spend time with certain types of people,
Yeah.
and I will only be understood by equally important people.
Yeah.
So speaking down to others that they believe are not equal.
Yeah.
They can be quite critical and look down on people that they feel are not important.
But these people can be, you know, I'm trying to get a sense now, because with everything that you are mentioning, I'm thinking there's many people, you know, in workplaces,
Yes.
you know, in universities, who exhibit these things, but they are functioning.
So and I think that's the importance between, am I exhibiting traits of narcissistic personality disorder, or am I a full-blown narcissistic personality disorder?
You know, before we, you know, as we're planning this show, we decided that we'll just ask people, you know, in society about, you know, what they know or what they think of narcissists.
Yeah.
So I'm going to ask our, you know, our guys to assist us, because there's a couple of voice notes and some videos that we received.
Sure.
So just press a pause in terms of what you were sharing. Let's hear what an average person, thinks about
Sure.
narcissists or narcissistic personality disorder. So can we have the first one?
The narcissistic mother. Let's talk about this one. Here we go. The narcissistic mother is sadistic. She takes complete pleasure in watching other people be miserable due to her behavior. Accountability? What's that to the narcissistic mother? There is absolutely no accountability. She's a victim of all victims and continues to be a victim throughout her entire life. She wants absolutely no family harmony whatsoever. She triangulates her children to no end. She is jealous if they get along. She wants to be the center of attention, but she doesn't want to be the center of a conversation, a true conversation about how evil she is and how evil she acts. She holds grudges forever. It could be years prior someone did something to her and she's still holding on to that thing. She'll do things like cut you out of pictures, not invite people on purpose, and just act nasty towards people for fun. The narcissistic mother is typically a rager. She rages for no good reason. She goes from 0 to 100. There is no in between. And the narcissistic mother is usually who develops the narcissistic child, typically the son, because she puts the son in a pseudo-husband position in her life and treats him like her partner. She always has a golden child and she always has a scapegoat child. She has a child that she favors in front of the scapegoat child, and she makes it known to the scapegoat child that she loves the golden child more than them. She's physically abusive, verbally abusive, emotionally abusive, psychologically abusive, spiritually abusive, just damn abusive. Always gossiping, always talking negatively about people, never has a good thing to say about anybody. Jealous, envious spirit, the most jealous and envious spirit you'd ever want to see. She probably doesn't have any real friends. If she has friends, they're very surface, superficial friendships where what she does is talk about people most of the time. She feels absolutely nothing for herself. She doesn't love herself. She doesn't know herself. And her identity is involved in her children. She lives vicariously through her children, controlling them at all angles and ends. All angles and ends. She wants in on everything, but brings nothing good to the table. She wants to be in the know all the time. And if you're not keeping her in the know, she guilt trips a lot. She triangulates her child against her grandchild because she doesn't want to see unity between them. She creates further narcissists in her grandchildren by creating that division between her child and their child. Yeah.
So we have just heard, from people on the ground. I'm not sure if all of those are actually on point in terms of the topic we are talking about. What's your sense of just some of the insights that we got from the people on the ground?
So yes, I think a lot of that, especially in terms of parental relationships, is relevant. I think a sense of being self-important and creating chaos in that sense. I think that is one of them. Triangulation is definitely something that happens, as well as gossiping, but also the sense of feeling jealous, especially with a husband and child, and creating a sense of admiring this child, putting this child on a pedestal. So that is definitely some of the mechanisms that parents and a narcissistic mother or any a parent might be able to employ. No sense of accountability, basically blaming others.
Yeah.
And lack of empathy, what they're talking about in terms of the creating triangulation, chaos. There's definite lack of empathy for the other children.
So, before we played these voice notes, you were still telling us a little bit about, these people with narcissistic personality disorders.
Yes. So I think one of the other symptoms, as well as they can also take advantage of others to get what they want.
Yeah.
And they have an inability or an unwillingness to recognize the needs and feelings of others. And I think that is what came up with the narcissistic mother.
Yeah.
It's either an inability or an unwillingness to recognize the needs of children or partners.
Yeah.
And it speaks to, again, lack of empathy. But also they can be quite envious of others, but also believe that others are envious of them because of their status and their superiority and their sense of needing to be admired.
Yeah.
And they can insist of having the best of everything, in the workplace, in relationships, the best car, the best office. They could insist on having the corner office, even if it's not
deserved.
Exactly.
Yeah.
They would need to want that. And in relationships, wanting the best of everything, wanting a new car when it's not deserved or when it can't be afforded at that point in time.
Yeah.
But I think what is also quite important to look at is how do they then deal with criticism? How do they deal with when people don't necessarily agree with them or don't admire them or don't see them as or within the status that they perceive to have?
Yes.
So they can become extremely impatient or angry.
Yeah.
When they don't get the special recognition, or when they just feel criticized, when they feel that their sense of self-importance has been attacked. And they have problems interacting with others, even when they feel just slightly slighted. A person not recognizing who I am, basically.
Wow. So, I mean, the more I listen to you talking about these people, the more I worry about, can they actually be able to function, properly in the workplace, in teams? Because most times, we need to be able to function in teams. So if I think I'm the only one who knows it all, who can come with the best idea, and I mean, if this kind of person becomes a CEO or a COO in the company, I don't think they will be able to take views or ideas of their subordinates, especially because he's the CEO, But the problem with that is that then that organization wouldn't necessarily grow because it's depending on one person's brain.
Definitely, and it can create a lot of tension and conflict within teams especially. And I think not just as the CEO or as a senior or as an executive, I think even on ground level, people that are in operational implementation roles can also, if there is somebody with a narcissistic personality disorder or just narcissistic traits, it can create a lot of tension and a lot of conflict even within those groups. Because then people would believe that they are still superior to the others, that they should get special treatment, that they are entitled to certain things that they might not be deserving of.
Yeah.
And that can spur on, more tension and more conflict at the end of the day.
Yeah.
And they can also then react with a lot of rage and contempt towards others if they don't get what they want.
What?
Definitely.
So if, for example, there are some awards that are supposed to be given, to recognize people, and they happen not to be amongst those who are being recognized, they can actually react very negatively.
Yes, definitely. And they have difficulties managing and controlling their emotions, and especially when they do feel that they have not been granted the admiration or the recognition or the self-importance that they feel that they deserve. Remember, all of this is perceived on their
It doesn't have to be real.
Yes.
It can be real or it can be perceived.
Definitely. But with a lot of people with narcissistic personality traits, it's definitely a sense of this is real. That's their reality, that, I'm not getting the recognition that I feel that I deserve. And they have difficulty managing that, which can then spill over into teams and create more conflict as well. And they've difficulty managing stress and adapting to change. So they would be some of the people that would resist change. and have a lot of stress in situations where there is, a lot of change in the organization.
Yeah. So we've really focused so far, in terms of what do they exhibit, to the extent, the extent of what they exhibit. But it's no use just sharing that information to say these are the things that would alert one to the fact that this person is most likely, somebody who has got a disorder, narcissistic personality disorder, or actually this is somebody who's got certain traits of narcissistic personality disorder. We've spent, most of the time there.
Yes.
But at the end of the day, what I also want to know, if I'm one of the people who are listening or watching this conversation, can somebody who has a narcissistic personality disorder, can they actually be treated with psychotherapy or any other form of specialized intervention so that maybe they get better? Is it possible? Are these people treatable? I mean, if we're talking physical illness, I would say, well, we can cure, or we can say, oh no, we can't cure, but at least we can control. Now, from a psychologist point of view, if you've got a patient who's got a narcissistic personality disorder, can they actually undergo an intervention and actually, recover? I'm just going to use that word, recover from the problem.
So as a clinical psychologist, I would not be a psychologist if I said no. Because I think psychotherapy, it depends obviously on the level of insight of the individual. I think insight is important, and insight speaks to my ability to recognize that I have a challenge, or that there is a problem, or that there might be interpersonal and self dysfunction. It varies. So research has shown that psychotherapy can be beneficial. But it also depends, and I think what we spoke of quite early on was about how long has this been persisting and how pervasive is it. So I think those are key factors to keep it to mind and to say, is this something that is in early adulthood? Because normally we see it developing in early adulthood, so post 18 years.
So are you saying under 18, you can't exactly label a person to actually
have a personality disorder yet?
Yes. So 18 and above.
Yes. So in early adulthood, I think the prognosis is probably better if the person is willing, number one, and has the insight. And then one can look at things such as individual psychotherapy as well as couples therapy, group therapy. Although in groups there might be a challenge if some of these traits are pervasive and they feel that, the confrontation could be quite traumatic for them if they feel criticized in a group setting. So you talked about an insight. Do narcissists have insight, or to the fact that they have a problem? I mean, one of the things you said before we started, you said narcissists never believe that they actually have the disorder. I think it has been proven that, through experience and research, that a lot of people with narcissistic personality disorder don't necessarily believe that they do have narcissistic personality disorder.
So if they don't believe, then how can they be able to come and seek help? Because they don't have any insight that they've got a problem.
Yes, so normally it would derive from the interpersonal dysfunction, and people in their lives would be the ones pointing it out. So it would be a sibling or children of parents saying that, I think that's a problem, can you accompany me to therapy? It would be colleagues, it would be partners. That's normally how people then end up there. But I think also very important is narcissistic personality disorder is one of the least diagnosed personality disorders.
And why?
And that is because people with narcissistic personality disorder specifically sometimes suffer from some of them suffer from mood disorders, such as depression or bipolar.
Yeah.
Some suffer from anxiety disorders. I've just mentioned, inability to deal with stress and change, and how they react to criticism, which might cause stress and anxiety. Interaction with others, but it's also limited insight because it would then be an externalization of blame. And a lot of them also suffer from substance use disorders. So they would tend to seek out help for those types of problems.
The other problems rather than...
Exactly, and then get treated for that. So pharmacology then comes into play where the symptoms of stress and mood disorders are being addressed and treated, which could sometimes help with the interpersonal relationships and functioning. Yes, so a combination of psychotherapy and psychopharmacology tends to help, and sometimes just the symptoms of the other disorders helps the person in the relationships.
So if we just look in society, and for today, I'll just look at the binary thing on gender, males and females, because there's still very little research done in the new way of looking at things where it's non-binary. So I'll go back to in research, where we're talking males and females. Would you say, most people with narcissistic personality disorder are females or are males, or there's no difference?
So I think currently most males, or the people that are diagnosed with narcissistic personality disorder, are mainly male, and less of them, yes, and less females.
Yes.
But I also think...
Why?
It is because of the overt aggression and a sense of superiority, the sense of status, which is much more how men or boys are being socialized in. That is being revered, a sense of standing up for yourself, showing your status, showing your achievements, where women are much more socialized to be humble and do not necessarily show that side because it might be seen as aggressive. So it's not to say that women are not or do not have... I think
I've met quite a number of females with serious traits of narcissism.
And I think if one then looks at what is underlying this, what causes narcissistic personality,
entitlement and manipulation and things like that.
We've heard in the clip, that narcissistic mothers actually rear narcissistic children. Wow. So I think a lot of times if a child gets put on a pedestal and gets admired excessively and gets seen as the golden child, that the propensity is great that child will also then develop a narcissistic personality disorder. So if you're talking about females with a sense of entitlement, it could be that they were reared as the little princess, as the queen of the house, as very special.
So, so can this thing run in families, or is it something that is an outcome of an environment, how they were parented and all of those things?
So there's research that that points to genetics, but there's also research that points to environment as well. So I think in order to really answer that question, and sometimes it's very vague, one doesn't really have a definitive answer of what causes that. It is really about doing a proper assessment and history taking and try and understand the individual. So I don't think it's just a blanket approach that one can assign to anybody and say all of them is genetically, that's the reason because of genetics.
One of the things that was mentioned by one of the people who sent a voice note was that these guys can keep grudges. In a conflict situation, they must come out on top. And if they don't, they will keep a grudge and they will hit back at some point. How true is that?
So I think what it points to really is the concept of having a narcissist or somebody instilling a narcissistic injury on me. And what the narcissistic injury points to, Doc, is really also called a narcissistic wound or a wounded ego.
Okay.
Or
I think wounded ego sounds like something I understand. Yeah.
Yes. So my ego got hurt. My ego got a wound.
Yes.
Or ego deflation even. That's what it's called. And that is really when I experience emotional trauma. It's a reaction to an emotional trauma that comes from criticism or perceived criticism of my sense of grandiosity, my sense of entitlement, my sense of greatness.
Yeah.
And it could also be I perceive criticism or attack because of betrayal or perceived betrayal.
Yeah.
So, for instance, in a relationship, a person might perceive that their partner has betrayed them, and then they become that then points to a wound of my ego, because how dare you? Because I am quite special.
Yeah.
And then they lash out. So what you're talking about, holding a grudge. So the lashing out is what's then called narcissistic rage.
Rage.
Yes.
Yeah.
And
So these things are closely related, the injury,
Yes.
the ego wounding, and the rage as a response during that time where you feel your ego has been damaged.
Yes.
Now, we have 10 minutes to go. And in these 10 minutes, I think I won't listen to the voice notes, but I just want to hear from you just the tips, because I said to people, we will talk about what this is, but we'll also get tips on how to handle. Let's start in a relationship. If I've got a partner or a spouse who is narcissistic, who's got the personality disorder, are there any tips on how I can navigate that? Because especially if we're married, unless we divorce, it's not so easy to break that kind of relationship. What tips, in a relationship situation? Because the next question will be, in a work situation, how can I work with a team member who's got this kind of problem? And I think the last one, if I'm a parent and I am dealing with a child of mine who is over 18, like you said, and has got this disorder, or vice versa, if a young adult has got a parent who's actually a narcissist. So just those three, because I'm just looking at the time.
Sure. I think a lot of it is overlap and a lot of it would be similar on how to react. I think first of all, it's important to recognize what are the symptoms, what are the signs. Knowing that, this might just be traits that this person is experiencing and or exhibiting, and it's not necessarily a personality disorder, but I think it's still important to recognize what is happening.
Yeah.
So what is it that you are seeing? I think it's important to always remain calm and reflect on your approach or how you will then tackle the situation. But it's important, very important, to set your own boundaries, because I think you can get caught up in a power struggle with somebody that has got personality traits, because remember, they are never wrong.
Yeah.
What they say is right, and they have a superior knowledge on all topics.
Sure.
So I think it's important to avoid engaging in that type of power struggle at all cost.
So that means you must withdraw. But then, if this is a person who's your spouse or long-term relationship, you can't be doing that forever. At some point, you can't be shrinking all the time just to avoid a conflict.
No, definitely. I think you need to seek professional help yourself in order to learn how to deal with a situation where you will learn how to set boundaries, but also where you make the decision whether this is a situation that you will stay in.
Yeah.
But also how to navigate it should you decide to stay.
Yeah.
So I think it's also to realize what is the difference between a healthy relationship and a toxic relationship.
Yeah.
But I think it's focus on the facts and not the feelings.
Yeah.
That is going to be very important, and especially in the workplace.
Yeah.
So rather instead of saying, I'm frustrated that you want to keep talking about this, you could say things like, we've been talking about this for 30 minutes and nothing is going to change.
Yeah.
So I think it's because they will not focus on the emotions, and they will try and engage in a power struggle.
Yeah.
So it's important to stick to the facts in the moment. I think it's also important, don't try and change them, because you will not be able to win. No. They always win arguments, and they will set it as a challenge to win the argument. So accept that they are
so
not
if
going
they have
to
not
change.
yet won an argument, that will continue until they are on door.
Yes. So I think it's also try and ignore the annoying behaviors, but you have to address the abusive behaviors.
Yeah.
And I think that's the important thing. But then to seek professional help. If it's a work situation, speak to HR. If it's in a personal relationship, seek professional help. If it's a friendship, I think you need to decide whether this is a friendship that you want to continue with.
If it's a parent?
If it's a parent doing that to a child, and it's a minor child, obviously other adults would need to step in. And hopefully the parent that is more aware and or have more insight can be able to step in, or other guardians to step in. One important thing though, just about narcissists at work, I think that I need to mention is often they are very good workers. And they take bold risks. And they are normally the ones who are unafraid to point out pitfalls that other people tend to overlook. So I think just to add a little bit of a positive spin in terms of that, yes, there's a lot of negativity, but they will be the ones that's not afraid to say, hang on, we're going to get into trouble with 1, 2, or 3. But they tend to be hard workers, apart from having believing that they are superior.
Sense of self, that the world revolves around them.
Yes.
All right. Do we have any question? We can take one question maybe. Is there any question either from YouTube or from Facebook? There's nothing. Okay. Sipo, is there any clip that we can play? A quick one?
Yes, there is.
Let's play one.
Okay. This one just came in now, Doc. So the guys... This one just came in now, Doc. Let's hear it. This is Queen. It's not the one that's there, guys. This is the one on that just came in now.
Hi. My name is Queen KR. So my views or points around narcissistic behavior, there was a time where I used to wonder, Uguti, are narcissists suffering from some kind of mental disorder, or they are just spoiled brats that are just used to getting away with everything. The saddest part is around narcissistic behavior. Most of the victims always blame themselves, or victims end up becoming toxic themselves. So somehow, it's just sad that narcissists are like always get away with everything, and they just don't want Uguti but acknowledge whenever they are wrong. I was with a narcissist for the longest time, and until I put my foot down and said, I'm just not continuing with this whole relationship. And instead of fixing himself, he just moved to another potential victim, of which he's always been doing that. So the sad part is people will forever be victims to this narcissist, and they'll never change. I just feel that narcissists will forever be narcissists, and they'll never change.
Wow. Sure, Liezl. As we look at wrapping up this conversation, she said a mouthful.
She did, but I think she has basically explained what happens when a narcissist becomes enraged. And they use forms such as gaslighting, and that is what she was referring to. That you will always be the victim because he's always right. So what is gaslighting? It's a form of psychological manipulation where they sow self-doubt or confusion, where you question your perception. You question
they do wrong to you, you raise it with them, they twist it around so that they actually almost accuse you of being the one who's on the wrong, and the way they do so is in a way that they even create doubt in you that
Yes, and because they have a fragile ego, what they would then do when they perceive you questioning them or criticizing them, they would seek out other relationships that are superficial and fleeting in order to then elevate their sense of ego or their sense of superiority or importance.
Because there was another voice note that came out earlier, which was actually talking about the fact that these guys, if there's a problem in a relationship and it ends, they quickly jump into another one, or sometimes maintain quite a number of relationships at the same time.
And I think probably next time we speak, if there's an opportunity, we'll talk about narcissistic supply, and that talks about these different relationships.
Can you whet our appetite?
So
we've got 2 minutes left.
Narcissistic supply really speaks to the ability to have a supply of people that will elevate me and make me feel important, and I then have this validation of a sense of superiority, and it fills or
so they are basically using
the grandiosity.
So they may have multiple partners to feed something within their ego.
Yes, definitely. But kudos to her.
What did you say?
Narcissistic supply.
Supply.
Yes.
What? Okay. Supply of people to inflate his ego.
Yes, basically, in layman's terms.
Yes, I'm trying to simplify it. Yeah.
But I also think the important thing what she did and what we spoke about is the ability to set boundaries. And her boundary was, I will not continue this relationship.
And so she exited.
Yes.
But then, at least that's a relationship, a romantic relationship. But if it's a parent or a sibling,
it's more difficult.
That's not the kind of relationship you can easily cut yourself out of.
Not necessarily, but I think a lot of people at times get to the point where they decide to, basically just implement tough love and say that I need to exit for me.
Yeah.
Because I need to have a sense of sanity.
Wow. Can this coexist with other personality disorders?
Yes, it can. Definitely. There can be traits of other personality disorders. So there could be elements of antisocial personality disorders, such as the law-breaking part as well. Yes, definitely, as well as histrionic, as well as, borderline. So definitely.
Wow. Liezl, we could talk until tomorrow, but I think you've shared quite a lot. And this is obviously in a podcast format. It's going to be available on YouTube and our Facebook page. So those people who either, joined us in the middle or those people who didn't have time, to be with us, they can still be able to find this on the Dr. Fundi, Fundi Lenyati on YouTube, or Dr. Fundi Lenyati on Facebook, the official Facebook page. Because I think it's important. This was a response to a request from people, and we have delivered on that. Then, people can visit, these channels, YouTube and Facebook, and learn more. I'm sure it's not the last time that I hijack you to come and share your expertise, share your knowledge about some of these things. So thank you very much, Liezl. You really helped me to have a much better and much deeper understanding, and I'm sure it's the same for everyone else. I could see, our production team, as we were talking, they were nodding. I'm sure they could see or remember somebody who's exhibiting some of these traits, or others, those who actually have a dysfunctionality. I hope none of them actually have this kind of, personality disorder, but we'll never know. When you were talking, I was also thinking, do I exhibit some of these things? I like the likes on social media. and the shares, could that be something that's trying to feed my ego? Am I, 5'2", being somebody with a disorder or not? But anyway, at least if I have some of those, I'll visit you for a consultation.
No problem, Doc. Was happy to be here. Thank you.
Thank you very much. And thank you to everybody who joined us. We really enjoyed ourselves trying to unpack. Some of these topics can be a bit technical, but we tried to simplify them as much as we could, and we'll continue to do so. So thank you very much. And once again, this podcast, subscribe, and also hit the notify so that when we next go live, then you can be notified of a new podcast that has come in or a live that is coming in. So thank you very much. We appreciate you all.